You're listening to The Scoop on Ultrasound, where the world of ultrasound imaging comes alive through dynamic conversations. This episode is brought to you by EDM Medical Solutions.
We're excited to welcome back Megan Platfoot to the show. Megan began her sonography career 7 years ago, working in both hospital and outpatient settings with a focus on vascular imaging. She later transitioned into education and now leads the Diagnostic Medical Sonography program at Clark State College in Ohio, where she helped the program achieve full accreditation in abdominal extended, OB/GYN, and vascular concentrations. Megan was recently honored with the 2024 Greater Dayton Imaging Professionals Education Award and was named BB Imaging's 2023 Educator of the Year. In this episode, Megan joins us to discuss the ever-expanding role of sonographers in patient care and to share her insights on how the profession is evolving and what the future holds for the next generation of sonographers. Quality supplies make a difference. At EDM, our mission is to help you enhance patient care. For over 30 years, we have been a leading supplier of medical imaging products and accessories. It all started with one product, Crystal Ultrasound Gel. And now our catalog includes over 300 products designed to support your practice. From probe covers to needle guides, EDM Medical Solutions is the partner of choice for over 2,000 healthcare facilities in the U.S. Learn about our range of ultrasound solutions on our website by visiting us.edm-imaging.com.
Welcome back to The Scoop on Ultrasound. Today we're diving into the expanding role of sonographers in patient care, a topic that has become increasingly relevant as healthcare systems evolve and imaging technology advances. With us is someone who exemplifies the transformation in this field, Megan Platfoot. Megan began her sonography career 7 years ago, working across both hospital and outpatient settings with a focus on vascular imaging. She rose to become a lead sonographer before moving into education, where she's made a remarkable impact. You may recall that Megan was a guest on season 1 of the show and gave us an inside look at DMS education in that episode. Megan developed and leads the Diagnostic Medical Sonography program at Clark State College in Springfield, Ohio, guiding it through full accreditation in 3 concentrations: abdominal extended, OB/GYN, and vascular. She also leads curriculum development, admissions, and faculty oversight, and she serves as lead faculty for medical terminology. Her work has been recognized across the industry. She's the 2024 recipient of the Greater Dayton Imaging Professionals Education Award, was named one of Dayton Business Journal's 40 Under 40, and received BB Imaging's 2023 Educator of the Year Award. Megan, it's a pleasure to have you back on the show.
Thank you for having me. I'm looking forward to it.
So let's start by looking at how the scope of sonography is shifting. We're seeing that sonographers are increasingly taking on responsibilities that go beyond traditional scanning. Sometimes that includes preliminary assessments, report preparation. In fact, a 2023 study published in the journal Diagnostic Medical Sonography found that 61% of surveyed sonographers reported being asked to provide preliminary impressions, a trend most common in outpatient and OB/GYN settings. The shift can reduce, hopefully, diagnostic delays and improve clinical workflow, especially in settings with radiologist shortages, which unfortunately is a nationwide case, right? So from your perspective, how are sonographers navigating these expanded roles, and what impact do you see it having on patient care?
Sure. So I think first and foremost, it's kind of hard for sonographers because every facility can be a little bit different in what they require from their sonographers. Now, the Society of Diagnostic Medical Sonography recently in the past couple of years have updated their scope of practice for a lot of components that I know I'll talk about a little bit later too for sonographers. Now, it's first and foremost, we teach it in our program, and I know clinically that sonographers are not supposed to be diagnosing, but we are playing in a little bit of an area where sonographers are experts in their fields, and it is expected that they know what they're doing, they know what they look at. So sonographers have to be able to adequately be able to describe everything that they're seeing in sonographic terms while still remaining in that window that they're not diagnosing. Now, most facilities are requiring sonographers to submit some form of preliminary report. Now, it depends on the concentration, the modality, and the facility and what their radiologist or the interpreting physician wants. Some interpreting physicians really want the sonographers to say what they're seeing, and others are okay with being more descriptive in terms of sonography terms. So it's hard, but I think as a field of sonographers, we really need to embrace our education and our expertise in our field. That we are not just people running machines, we are not just picture takers. We know what we're looking at. Any sonographer can tell you the education that goes into it is intense. That we want to embrace that. We want to embrace among other professionals in healthcare that we know what we're looking at and we know what's going into it. And being able to describe those appropriately and accept it, especially in our facility, to make sure that we're compliant with what the facility wants as well. But being able to do that will just increase patient care, that increases patient quality and efficiency across the board. That way, patients can get the diagnosis that they need and they can get it in a timely manner.
Right, and we really need that as a healthcare system as a whole in the US, right, is greater efficiency. Now, this is really interesting. Could you also tell us what your thoughts are on how we've arrived here? Has it really all been about that need for efficiency and shortages, or do you think that to a certain extent as well as the profession has grown, as the sonography field has grown and matured, do you think that there's a greater sense from other clinical areas, especially physicians, where there's a more of a trust in the profession? Do you feel that that's the trend, or do you think that that trust has been there, but we really have a need now?
I absolutely think that trust definitely comes into play. You know, when we're thinking about shortages across professions, so there's shortages in with sonography, there's shortages with radiologists, that a lot of the times that these professions are really relying on each other. So I think trust definitely comes into play, and especially when sonographers have worked in the field for an extended amount of time, they do gain a lot of trust with their interpreting physicians. And at the same time, I know from an education standpoint, we're trusting that the education that these people are receiving when sonographers graduate, that they've prepared them to be able to interpret things that they're seeing, especially with that clinical component that goes into a lot of sonography programs and should go into a lot of sonography programs. So I think trust comes into play. I do think shortages, that I think everybody wants things quicker and quicker. So I think shortages is definitely kind of some of the pressure that's coming into play when we're thinking about how much detail sonographers are giving. And like I said, it's facility dependent. So across modalities, physicians really utilize the expertise of sonographers more than others, especially in fields such as OBGYN, where the sonographer is and should be the expert in that office and should have a physician that they can heavily rely on when they're trying to interpret the findings that they're seeing in real time.
Right. And I mean, it's really fascinating to witness, right, the evolution of a profession, right? That's what we're talking about is the expanding role.
Absolutely.
And you really see that more and more. I think there's more of an integration into multidisciplinary teams, right? So you see that sonographers are increasingly becoming part of those clinical huddles, a part of the care team. And so, I'd love to hear more on that of how you've seen sonographers collaborate with physicians, with specialists in those real world settings, and what kind of effect you've seen it's having on patient outcomes.
Sure. So I think, first and foremost, when I think about this kind of collaboration, my brain first goes to interpreting physicians and sonographers. So whoever is interpreting your images, they want to be able to trust that what they get is exactly what the sonographer is seeing. Sonography is a little unique in the fact that at times we can send still images, at times we can send things like cine loops, like video clips, to be able to share what we're seeing, but they're not always getting the whole picture if the sonographer's not taking it. So it's necessary, it's vital that the sonographer knows the whole picture of things. They don't get tunnel vision when they're looking. And when they're scanning patients, that the way they can send over exactly what they're seeing to be able to adequately get that patient care and that diagnostics that they need. And the interpreting physician at the end of the day is trusting the sonographer, trusting the ultrasound department that their quality control and their initiatives in their department are where they should be. I do think at the same time, though, we traditionally think about sonographers and physicians, but even more, sonographers need to collaborate across the board with all of their healthcare professions. So it's not just sonographers and physicians that are going into patient care. We're thinking about the people that patients are seeing when they walk in. We're thinking about other kinds of diagnostics like X-ray, CT, MRI. We're thinking about a medical lab. We're thinking about all these people that are going into that form of patient care, that we need to look at the big picture, that patients are people. And while we may get them and we may see them for a certain amount of time, we have to understand more about each profession and what goes into it. And I said earlier that it is vital that sonographers embrace the education that they have,
Right.
that we are not downgrading what we do. I hear that a lot, and I think we are coming out of that a little bit as a profession, but the education is intense, and the necessity for individuals to understand pathologies and everything that are going into it. We need to embrace that, and we should share that as much as we can. When people are asking about what we're seeing, even if it's patients, if patients are asking, how do you know what you're looking at? It's a great opportunity at an open door to share, your educational journey, or how you learned, how to become the sonographer that you are, and, how you can seek the best image optimization and just try to be the best sonographer that you can. So I think in the healthcare setting, definitely try to collaborate as much as possible, because sometimes you do get kind of sectored off in hospital, or even in clinics. You can kind of get in your little bubble. So I think it is opportunities to collaborate across the board. And then from the educational standpoint, I know here at Clark State, we have a lot of really high quality programs. And how can I get my students interacting across the board with those students? That way, by the time they reach the educational sector, I'm sorry, the healthcare sector,
Right.
that way they're already with that foundation that they want to look together.
Exactly. It begins there. And do you think that in the healthcare setting, in the clinical setting, do you think that lack of awareness from other clinicians about what it takes to become a sonographer and what being a sonographer is, right? More than just a surface level understanding. Do you think that that lack of awareness in the past, at least, has played a barrier to the integration?
I absolutely do. So I think at times, and I know my students feel this, I know when I was working clinically, I felt this, that sonography is a little misunderstood, especially with what goes into becoming a quality sonographer. There are multiple disciplines within sonography. So just saying sonography, we're not talking about all sonographers in the world. So there are very specialized forms of sonography that are necessary. And I think embracing the education that goes behind it and the quality and the determination that goes behind becoming a quality sonographer will only, one, help patients. I mean, if you're determined to be the best sonographer possible, you're inevitably going to be helping your patients. You're a quality employee within your facility because you want to be a great sonographer. But we're also sharing within a facility and within the profession that we know what we're doing, we know what we're seeing, we're still within our scope of practice, but at the same time, you don't want to degrade what we know went into our education.
If you are high-level disinfecting your ultrasound transducer, it's likely you're soaking the probe or using an automated HLD device. But there's a better option out there. TriStel Old can high-level disinfect your transducer in just 2 minutes and costs under $3 per cycle. Sound too good to be true? Request a brochure today and learn why so many practices are switching over to TriStel Old. Visit us.edm-imaging.com/TriStel. That's TRISTEL. And now, back to the show.
Right. Exactly. No, that makes sense. I mean, at EDM, what we do is we started with ultrasound solutions, right? So I think that we sort of have a bias, right, to always thinking about sonography. But that's one of the reasons we have this show, right, is to create awareness, to create community, but also to create awareness because you realize in talks sometimes with other clinicians that there is sort of a misunderstanding of what it takes to become a sonographer. And just from other episodes that we've had, other conversations with educators and clinicians like yourself, there's that sense of we have to create awareness. And not just awareness for patients, but like you were saying, that's so important too, right? To teach patients what it is. It's not just about scanning a baby, and that's what's typically portrayed in media. And I feel like most patients realize it's more than that when they have to get something else scanned, right? So that's just so important. And we've been talking a lot about too of how to address the shortage. One of those ways is awareness. So really fascinating just to hear how that's gone evolving.
Mhm.
Now, moving on to technology, because we can't have, I think, almost any episode of this show without talking about technology, because it's really changing the game and it's affecting education, but it's also affecting this expanded role of sonographers. From your perspective, what new technologies would you say you're most excited about in sonography, and how do you think those technologies are really influencing the skills that sonographers have today, especially in this expanded, evolving role?
Sure. So I think, over the course of the years, I think elastography comes to mind when we're thinking about technology. Now, there are facilities that have been doing it for years, and I know there are facilities that still have not incorporated it. And I think with any new technology, and contrast ultrasound is another big one that comes into play for me when I'm thinking about this. But with any new technology, it's the sonographer's responsibility, not necessarily in their facility, but to know what's up and coming and to know what's new in their field. So, seeking out as much education as you can, even if you're not doing it within your facility, you want to be prepared if you ever change jobs, or inevitably, sometimes your facility will start to implement it, especially as your facility is purchasing new machines or new physicians are coming on that really want it. Then you really want to be at the forefront of that education, and you do not want to be blindsided with a new technology and you're expected to learn it right away. So I think with any of them, seeking out professional organizations would be essential when we're trying to kind of think about how the education piece comes into play. So things like the Society of Diagnostic Medical Sonography, looking at webinars, anything like that. There is the International Contrast Ultrasound Society, which they have a ton of information about ultrasound contrast, especially if your facility is trying to incorporate it. I think, seeking any of those out, whether it's the facility or the sonographer as an individual, but what a great opportunity to collaborate with your peers and to collaborate with other sonographers within your department. That way, everybody's on the same page with any new technology that's coming out. I think any new technology, as long as by the time it reaches the sonographers, it's been vetted. There's so many opportunities for education that we're thinking of access to patient care, quality care for things like contrast ultrasound. It's cheaper, it's safer, it's faster than a lot of the contrast we're thinking of when we're thinking of medical imaging. And we're just elevating diagnostic accuracy with patients and with patient care. At times, we're reducing the need for invasive procedures. We're broadening the scope of practice for sonographers, which I think is so exciting. You're as a sonographer, the more you know, the more marketable you are.
Right.
And I think seeking out the education, but relying heavily on the machine vendors and the people that are coming in, places like the International Contrast Ultrasound Society, of using, what they have available to sonographers. And also, like I said earlier, with things like purchasing new machines and everything like that, taking advantage of what comes with that, which is like the educational component, to ensure that we want that high quality patient care, but we also want to know what we're doing as much as possible. So it is a balance, and some of that falls on the sonographer and some of that falls on the facility.
Exactly. And I think that at times with technology, and we've talked about this with other clinicians, but there's this fear, right, with the technology that somehow you're going to be replaced or it's going to simply, yeah, be replacing really, I think is the ultimate fear, right?
Yeah.
The person. But what you're saying is so true that you're pointing to the fact that it's so important as a sonographer to start mastering the technology, right? And using it and leveraging it. And I think that that's a perspective shift that many people are having. right? I think that there's some people who still it's hard to change. It's always hard to change in any profession, any clinical area. But I think that there's a perspective shift happening, right? And a great deal of encouragement to like, hey, go out there, try it and learn it. And it's really easy too, especially when you've been doing something for a while, to if you don't keep up with the pace of change, you fall behind. So you make a great point of being more marketable, especially now. It's so important because there's so much that's going on, right? And the role continues to expand.
Yes, absolutely.
Now, with all those changes, education also has to keep pace, right? And so a 2022 report from the SDMS actually emphasized that future ready sonography programs, right, have to include simulation training. They need to include the advanced physics, modules on clinical judgment, and there's also an increasing demand for those micro credentials and cross certification. So I would love to hear about how your program is preparing students for the evolving landscape and what role do continuing education and certifications play in staying competitive as a clinician?
Yeah. So I think kind of what I said earlier, it's the sonographer's responsibility to keep up on technology. I feel the exact same way about myself. I am a sonographer. Now, my role here is in education. And for me, it is essentially vital that I stay up to date on as much technology as I can because at the forefront, our program faculty are the ones that are expected to teach it. And when students come to me, they have usually not a whole lot of knowledge about sonography. So my ultimate goal here at Clark State and in the education sector is to provide the best sonography education that I can. That way, the sonographers that are leaving here can then share that with the sonographers that they're working with. So I think my role is staying up to date on as much technology as I can. So whether it's through, I would say we live in a time where education is so accessible across the board where we don't have to go in person to conferences. I love sonography conferences and I recommend them to everybody. But if I'm limited on things like financial reasons or family reasons, I'm not limited to my education just for in person conferences. We have virtual conferences, we have on demand webinars, we have all of this education available to us to kind of get a foot in the door of trying to learn more about new advancing technologies or even best practices within the field or within education. So I think it's my role to stay up to date as much as I can. And then I work among myself and my program faculty on how do we best incorporate that. So sometimes it's incorporated into the didactic form of our education. Sometimes it's collaboration. So collaborating with places like EDM or, any kind of vendor or machine manufacturer to learn as much as I can. That way I can then share it with my students and take it into the future as well. Now, and I think when we're thinking about continuing education, I say this all the time to my students, forever be a lifelong learner. That things are constantly evolving within sonography and within a lot of different professions. That we do want to seek out as much education as I can. And I've spoken a lot today about like online education or education in the for like a more traditional form. But I really go to things like mentorship. So seek out the sonographers that know more than you. And that is such a great thing. Do not be intimidated by that because it is so vital to find sonographers who love to teach. And I think if you can work at a facility with a sonographer that knows so much more than you need to absorb it like a sponge. That most people know that because they're in that mindset that they want to be lifelong learners. So I think that is first and foremost. Now, when like my students or when new sonographers or even sonographers that are changing positions, if they have the opportunity to learn more modalities, take full advantage of it. Sonography is unique in a way that we have all these different concentrations where sometimes sonographers are cross training across specialties. And as they cross train and as they learn from people that are great teachers and great sonographers in their own right, that we should do everything that we can to better our education with it. So sometimes it's the didactic, the bookwork side of it. Sometimes it is more traditional like online webinars or in-person conferences or anything like that. But as we gain that education, it is our responsibility as sonographers, and what everybody should do is let's go get registered. Let's go through the formal process to show that I know what I'm doing and I know what I'm talking about and I've taken this effort and this is the fruit of my labor. Yeah. So that is important too when we're thinking of sonographers. And you never know what the future holds in sonography, where if you become registered in every modality that you're eligible for, you never know what your future may hold and where it may come into play down the road as well.
Yes, it is truly such an exciting field to be in, right? Because of the amount of opportunities that one has. And you make such an important point in that the didactic portion of learning is crucial, of course, but then you can't be in school forever. So the experiential learning is so important to continue learning even on the job and finding a mentor. And that really is going to lead me into the next question. So we could talk a little bit about mentorship because you, of course, have been an educator already for a while. You created this program, you spearheaded the creation of the program, and you've had that impact. You were even named, again, Educator of the Year in 2023 by BB. So, talking about mentorship and that importance of really, pouring into another sonographer, right, and passing that knowledge down, could you share a moment where or when a student's breakthrough really reminded you of why you do this work? One of those like landmark moments, right? Where it's like, wow, this is exactly why I do it. I think it would be great for the audience to hear that.
So I think, when I think about that question, there are several students that come to mind because I think, and I am a true believer, that sonography is hard. And I think, and I say that in the best way possible because it is hard. And then when people are able to graduate and to finish it, let's embrace that because it is an effort and it is a devotion that goes into it. Now, I think of as opposed to one specific individual student, I think of our student population, and this as a whole now, that we are living in a time where a lot of the times our students cannot dedicate their whole lives to their studies, that they may have families at home, they may be working while they're trying to go to college, or they may be changing careers, where there are dynamics with students that I think I never try to forget that our students are individuals. They're still people while they are my students. And I think approaching any kind of education from that mindset has only been beneficial to me and beneficial for me getting to know each one of my students. I think being realistic on what our requirements are, I am proud to be a program director of KHEP accredited programs. I will not falter on the requirements that come with that, but how can I best support our students? So I know our college has a great support system for our students, but that also a lot of times requires that I know that I have made connections and I am embracing the everything that our college provides to our students so then I could best advise students for properly for the things that they may need. And I think collaborating with our clinical affiliates and the mentors that come from clinical instructors are essential and important because a huge component of our education is the bookwork, and it obviously is the sonography scanning component. But as students, and even for new graduates or graduates that are starting at new facilities, there is a component that goes into learning personalities and learning how to navigate people. And that goes for sonographers and for patients. So I think that is another component that I try to teach as a whole. And then at times we do have students that may struggle a little bit more. So some students struggle in the bookwork side of things and some do struggle more with scanning. So how can we better support them and how can we do most of the time a one-on-one education for these particular students? That way, it never feels good when we struggle. But I always want our students to know that they have the biggest support system here. And our ultimate goal is to graduate them as the best sonographers they can be, because I am a firm believer that my students are going to be in the field and they will then have a positive impact on the sonographers around them. And the impact that we make is far greater than just the students that are coming through my program. That if they are quality sonographers when they leave, that would bleed out into the field in its entirety as well.
Yeah, that sort of big picture mentality I think is so important, right? Especially as an educator, because being an educator is hard, right? So I think for
At
the
times.
at times, so I think that for even the educators listening to this, I think it's very encouraging, right? To remind oneself of like the vision of this is why I do what I do. And even for maybe some students listening to this, I think it's really great to hear from you how people make it through, right? There's a light at the end of the tunnel, even in those tough moments, and it's very rewarding. And in the end, it's a lifelong journey of learning as a clinician to be able to be one's best. Megan, this has been a really rich conversation. Thank you once again for being on the show, and thank you for the work that you and your team are doing.
Thank you so much. I appreciate it.
Thank you for listening to this episode of The Scoop on Ultrasound. Subscribe today to be notified when new episodes are released, and visit our website, us.edm-imaging.com, to learn more about who we are and what we do.